Hi, I'm Dr. Amerjeeth and welcome to the SCALPEL, where you can learn about concepts in surgery, clinics, operative surgery, and practice essentials. Sometimes, when you are planning to take a bite, the suture material itself comes in the way and hinders with the bite. In this situation, what you can do is you can hold the suture material between the fingers and the needle holder so that it doesn't come in the way. So whenever you are trying to adjust the needle with the needle holder, try not to lock the needle holder until the needle is in position. So until then, adjust it with the thumb forceps, and once the needle is in position, then you can lock the needle holder. After taking a bite, when you are trying to take the needle out, always rotate the needle holder along the curvature of the needle to retrieve it. After taking a bite, in order to hold the needle in situ, don't hold the needle using a thumb forceps. Instead, hold the adjacent tissue using the thumb forceps so that the needle will stay in place. While making a knot, try avoiding holding the thread like this because you will have difficulty in sliding the thread along the needle holder. So always hold the tip of the thread while making a knot. While taking a bite, instead of entering the tissue at right angles, there is a lot of pronation which is required at the wrist. So in order to avoid that, you can use the palming technique so that the movement at the wrist will be minimal. You can lock and unlock your needle holder using the palming technique. And always remember not to hold the tip of the needle using the needle holder. While suturing, you can place the thumb forceps in your left hand itself, and also remember to point the needle away from you. So when there is excess suture material, you can use the middle finger and little finger of your left hand in a figure of 8 manner to keep the excess suture material within your hand. In this way, the suture material will not come in your way while suturing, and also the entanglement of the suture material can be avoided. While suturing, always remember to cross the knot so that the knot is placed on one side of the wound and not directly over the wound. So there are two techniques for it. Number one, after making a loop, you hold the tip of the thread and rotate your needle holder in a counterclockwise manner in such a way that it already forms a loop. As you can see here, when you tighten it, the knot is already squared and is on one side of the wound. In technique number 2, you make a loop and you cross your hands. After crossing, you pull both the thread towards one end of the wound so that the knot is crossed. That's it for today, and thanks for watching. If you like this video, share this with your friends and subscribe to my channel by just clicking right over here. And if you want me to make videos on specific topic, let me know it in the comment section. Thank you.